Hi everyone. Today in this video we will discuss Amantadine. Amantadine is one of the well-known drugs which acts as anti-Parkinsonian agent as well as antiviral agent. This drug can be used in the treatment of influenza A virus where it inhibits the M2 ion channels so that it can inhibit the entry of virions into the host cell. But because of development of resistance, nowadays Amantadine is somewhat less preferred for influenza infections. And this drug is chemically having adamantine nucleus. So simply Amantadine is a adamantine 1-amine. Nowadays this drug is used for the treatment of dyskinesia that is developed due to the treatment with levodopa, which is again another anti-Parkinsonian agent. So levodopa can produce a dyskinesia which can be controlled by Amantadine. Similarly, antipsychotics like chlorpromazine can also produce the dyskinesia. These symptoms are slowly developed after long-term use of antipsychotics. Again, in such condition, Amantadine can be used to control these Parkinson-like symptoms. So today in this video, we are going to see how this Amantadine acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. Now let us see the chemical nature of this drug. So this is the structure of Amantadine. We can see the ring system adamantine nucleus which is attached with amine group at the first position. So this is simply adamantine 1-amine. Now let us see how this drug acts. Even the exact mechanism is unknown. Amantadine mainly increases the dopaminergic transmission within the CNS. So dopamine is stored into the presynaptic neurons, where the postsynaptic neurons are equipped with D2 receptors. When action potential reaches to the presynaptic neurons, calcium can enter to produce the exocytosis so that the dopamine is released and it can act on D2 receptors, which are the G protein coupled receptors which increase the postsynaptic activation, resulting in the improvement of motor symptoms. But the action of released dopamine is controlled by its reuptake into the presynaptic neurons by one of the transporter, dopamine transporter. Through this transporter, dopamine can again enter into the presynaptic neurons, which reduces dopaminergic transmission as well as postsynaptic activation. Now, in the patients with Parkinson disease, this dopaminergic transmission is reduced, leading to bradykinesia and other motor symptoms. Now, Amantadine is one of the drugs which improves the dopaminergic transmission. It can act on the dopamine transporters, thereby it inhibits the activity. Now, dopamine cannot enter into the nerve terminal so that the dopamine levels within the synaptic cleft are going to be increased. This is one mode of action of Amantadine, but this drug can also directly activate the D2 receptors, resulting in the increased postsynaptic activation. So, this improves the symptoms of Parkinson disease as well as dyskinesia. That's why this drug is given along with antipsychotics to reduce the motor disturbances. Apart from this, Amantadine can also act on NMDA receptors. These NMDA receptors, which are expressed on dopaminergic neurons, can control the dopamine release. Now, Amantadine acts as a NMDA receptor antagonist. So, it can block these NMDA receptors so that the inhibition on dopamine is going to be removed, leading to increased release of dopamine. In this way, Amantadine improves the dopaminergic transmission within the CNS, which improves the symptoms of Parkinson disease. What are the precautions? One of the important precautions of Amantadine is that this drug is going to increase the dopaminergic transmission. So, more dopamine is going to be released into the CNS. So, the increased dopamine levels within the CNS may produce hallucinations, particularly auditory hallucinations can be observed, sudden and strange sounds can be observed by the patient, and visual hallucinations can also be observed without any physical presence, and some delusions, illusions of paranoid nature. All these symptoms can be observed by Amantadine as it increases dopamine levels within the CNS. So, care should be taken, and any development of psychotic symptoms on long-term use of this drug should be closely monitored. Similarly, this drug can increase the orthostatic hypotension, resulting in the dizziness in the patients. Some lightheadedness can be observed, and it can also produce some confusion, syncope, fainting sensation. All these can be observed with the Amantadine. So, whenever the patients are taking Amantadine for longer periods, care should be taken when they are dealing with daily activities such as driving the vehicles or working with machinery, dizziness and syncope within the patients. Another important precaution is on the withdrawal. When this amantadine is suddenly withdrawn, it can produce some increased anxiety, agitation and muscle rigidity, which resembles neuroleptic malignant syndrome, which is associated with muscle rigidity and hyperthermia. So all these symptoms can be observed on sudden withdrawal of amantadine. So the dose of the drug should be slowly tapered and it should not be stopped suddenly in order to avoid withdrawal effects. Similarly, this drug can produce some compulsive behavior within the patients. So it may increase excessive eating or psychotic behavior, which should be closely monitored. What are the side effects? The important side effects of amantadine are mainly on the CNS. So it can produce some hallucinations, dizziness, confusion, headache. All these are because of increased levels of dopamine within the CNS, and it can also produce orthostatic hypotension, and amantadine can also produce anticholinergic side effects. It can increase the dry mouth, constipation, blurred vision and even urinary retention, which may result in urinary tract infections, and finally this drug can also produce some peripheral edema within the patients. How it is given? This drug is available in different dosage forms. It is available as normal tablets, which are available at a strength of 100 mg, or it also available as normal capsules, again at a strength of 100 mg. And this drug is also available as extended release tablets or control release tablets, where it is having a coat on the tablet. This coat is slowly dissolved so that it produces slow release of the drug in an extended as well as controlled way. Finally, this drug is also available as solution. So in different dosage forms it is available. The strength of the drug depends on the type of dosage form. So even the dose of the drug depends on the type of dosage form. So that's about this drug amantadine, which is an anti-Parkinsonian agent as well as antiviral agent. Even this drug is indicated for the treatment of influenza A viral infection, but because of development of resistance, this drug is somewhat less preferred for influenza. Nowadays, this drug is more preferred for the treatment of dyskinesia produced by antipsychotics such as chlorpromazine. Otherwise, this drug can also be combined with the levodopa in order to reduce the dyskinesia produced by levodopa. Hallucinations, delusions, illusions are the important side effects that are produced by this amantadine, because this drug increases the dopamine levels within the CNS. And this drug can also produce some anticholinergic side effects. In some of the patients, it can produce some compulsive and psychotic behavior. And this drug is available in the different dosage forms. Particularly the extended release tablets or capsules are more preferred to control the dyskinesia within the patients. So that's about this drug amantadine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.